Okay, I did it. It's recording on the cloud, or do I just, yeah?
Fine.
Okay.
All right. I'm going to start again with that. I'd like to welcome you all to our kickoff action hour from the Voting for Climate and Health team of Climate Health Now. I'm Cynthia Mahoney, a retired nephrologist from Danville. And along with my colleague, Margie Chen, we'll be moderating the meeting. Thank you for joining us for our Earth Week event. As the recent IPCC report makes clear, the stakes couldn't be higher and we need action now. By the time you leave today, I hope you will be as excited as we are about our collaboration with Vote ER, connecting climate action with healthcare-based voter empowerment. Right off, I'd like to invite everyone to post your name, city, and email in the chat, as that helps us to build community and connections. We're so fortunate to have with us today two speakers who will share their tremendous experience in healthcare-based voter empowerment to lead the way for us. I'd like to introduce Cynthia Romo. Cynthia, can you wave to everyone? Say hello.
Hi, everyone.
And Cynthia is the Civic Engagement Program Manager at AltaMed Health Services, serving more than 300,000 residents in Southern California. Cynthia will share their groundbreaking experience in outreach, education, voter registration, and Get Out the Vote initiatives. Next, we'll have Noor Chada, a medical and master's student in the UC Berkeley UCSF Joint Medical Program. Alongside Dr. Stephanie Fong Gomez, she is the co-founder of the Voice Project, Voting for Our Health, Interests, and Communities Everywhere, an initiative to promote youth civic engagement in pediatric spaces. Noor, you want to say hello so people can see you? All right. And then our third speaker, Evia Loam from CHN itself, is an OBGYN at La Clinica who is working her way through the challenges of implementing voter registration in her own clinic. We hope that after hearing our speakers, you'll be inspired to take 4 simple but powerful actions we'll introduce in collaboration with Vote ER. And then we'll have 10 minutes with all our panelists to answer your questions. So to frame things, I'd like to tell you a little bit about how we arrived at our collaboration with Vote ER. When we founded Climate Health Now in 2019, we expected to be working on physician advocacy, on divestment and decarbonization, and then COVID hit. As health professionals, we were appalled when we saw the lines to vote in the Wisconsin primary. And sure enough, it became a super spreader event. I did my training in Wisconsin, so it was personally distressing to me to see people who could be my patients and my colleagues put in danger. And it made me angry because no one should have to choose between their health and their vote. So we formed the Healthy Voting Team, and in collaboration with the Union of Concerned Scientists, we educated voters about keeping safe, that they could trust mail-in voting, and how to protect themselves if they did vote in person. As part of that initiative, we had our first action hour, encouraging members to get individual badges from Vote ER. After the 2020 elections, we thought we could hang up our spurs or our lanyards and disband the team. But 2021 brought an assault on democracy with hundreds of bills aimed to suppress the vote of the most environmentally impacted patients. And that made us realize we still had a role to play. 2021 taught us many lessons: that voting is a social determinant and a political determinant of health, that voting is a climate issue. The people we elect determine whether we have clean air to breathe and a safe climate to live in. And that electeds respond to the people who vote. So being registered is so important, and it demands that every voice is heard. And that our health voices are incredibly powerful, and we should be asking ourselves, how can we use our voice for democracy? We concluded there is a unique role for the health voice. Health providers have a trusted voice and a unique connection to the most environmentally impacted communities, where voting can change the conditions of their health, and that overlaps with the unregistered eligible voters, especially the young, the poor, and people of color. And as we explored opportunities to employ this, we were thrilled to see that Vote ER is a perfect ally, and that they've moved on to more collective action, institutionalizing all of their processes to unburden individual providers and increase their reach. And we were happy to see that we're not the only ones thinking this way. The Medical Society Consortium had a panel at their annual meeting called Optimizing and Accelerating the Power of Health Professionals. And they asked the panelists this question: what would it take for the healthcare community to dramatically accelerate equitable climate and health solutions? And the unequivocal answer was vote. Expanding democracy is a health solution. And with that background, please help me welcome Cynthia Roma. And you want to share your screen, Cynthia, right?
Yes.
Are you able to do that?
Yes, let me do this. I'm so sorry. Let's see. Can everybody see my screen?
Yes.
Perfect.
Perfect. Well, thank you very much to everyone. I'm inspired by everyone here and everybody who's going to begin their journey with civic engagement in their organizations. And again, my name is Cynthia Roma, Civic Engagement Program Manager at Ultimate Health Services. And we really started, I want to take it back just a little bit, and how we started with rooted in social justice in our communities. We both have provide service in LA County and Orange County. Like Cynthia mentioned, about 300,000, 400,000 patients now, but these are the most underserved and disadvantaged of our communities. I actually live in one of our service area in Southeast Los Angeles, and I am an ultimate patient as well as my family at a community health center. And again, community health center started in a civil rights and social justice movement. And I do love the quote where from Dr. Martin Luther King Jr. saying, of all the forms of inequality and injustice in healthcare is the most shocking and inhumane. And we've seen this as well through COVID, how that brought to light a lot of these inequalities and lack of resources in our community. But again, what we're talking about is how do we address these social determinants and political determinants of health in our community? Like one of our providers says, the magic happens outside of the exam room. There's only so much we can do for our patients in the exam room, but what happens outside of that? And in the slides, you'll see there's these little food for thoughts, little pop-ups that to get you to start thinking about how do you align, the mission and vision of your organization and how you serve the community, and what does the patient leave with when they leave the exam room? Again, these are our services that we provide, but this is just to show what are those opportunities that you could engage your staff, your patients, your providers. There's all these great opportunities in the spaces that these services are provided in. And here we're talking about the role of community health centers in civic health. And I really love this image of saying what goes into your health. Yes, healthcare is about 20%. Beyond that is everything else that we would call our social determinants of health, from access to clean water, air quality, green spaces, access to transportation, and the safe and quality housing as well. That's where we want to have our community engaged and advocate in these issues. And I'd like to show kind of the graph where we started with. We start with our clinics, and these are these red icons in both counties. And we started addressing through a civic engagement model, low propensity voters. Who are these voters? Meaning they don't vote in elections or usually in only major elections. So typically they do not receive any information from any campaigns. So these are highlighted in yellow. On top of that, we also worked with our census talking about representation and being counted. These are hard to count census tracts as well. So these are our service areas. And if we superimpose the impact of COVID in our communities, I imagine it'll be in the same areas as these are highlighted, unfortunately. Again, how do you, and I don't want to overwhelm anybody who's beginning. We start small. It is challenging to begin, but it is doable. So I do want to say that. The first thing that you really have to think about is this buy-in from executive leadership. We have our leader who is completely involved in the civic engagement model and social justice. And beyond leadership, how do we embed this in the fabric of the organization? So it's not these sporadic campaigns. It's not this department that sits, in this tiny corner. It's actually embedded throughout from the beginning of the journey of your staff, all the way to the patients and the community. Here is actually our model. It's a 5-touch model. We both have external and internal. But this is, it seems a little bit complicated, but it's actually, it gets you to thinking, where are these opportunities to engage your patients when they come into your clinic or hospital? And how do you ensure the civic health of these communities as well? For our internal 5-touch model, it's just showing where we could have these one-on-one conversations or these informational nudges to our community. For example, as soon as they walk in through the door and are greeted at front desk, usually front desk will have flyers and buttons and information about the campaigns or voter registration applications actually at our front desk. In the lobby, the signage, the videos. Now going back to our back office staff, during Vitaling, we would have posters and flyers, just so it's a unified message with all these nudges. And the most importantly, our providers who provide these messages, for example, by simple wearing a vote button or having the VoteER badge that you could, I know we're gonna look into that, and share this information. And again, when patients leave. So basically this is just showing, start thinking about these opportunities of engaging patients without interrupting clinic processes, and obviously keeping in mind PHI confidentiality and HIPAA compliancy, of course. This is our external model. I know it's a lot, but remember, we start slow and then we ramp up, but this is how we engage our community within our service areas externally. So from phone banking, text banking, earned and paid media, and direct engagement. But again, not to overwhelm, this is step by step. So these can be aspirations for yourself and your organization. And you could start by materials that are already created with our co-branding with VoteER, and then with, and available for you to co-brand it, add your logo. Here's the main thing, I'll be honest, of all the conversations that we've had, it is challenging to start. We understand that, but let's take the first step. From there is, how do you continue sustainability? We start with organizational leadership, looking at internal champions, and making sure it's HIPAA compliant and engaging in this nonpartisan work, but also start talking about how do you track impact in your community. But like I said, no effort, there's no such thing as a small effort. Each effort creates impact, so celebrate the small wins. And I hand it back to Cynthia.
All right. Wow. Well, thank you. I think I need to share my screen again, right? To make this work. Okay. 1 second. All right. So Cynthia, thank you. That was tremendous. You guys have really been a pioneer. Now we want to shift gears and have Noor talk about opportunities in the pediatric space that you might not have thought of. Noor, do you want to share your screen?
Thank you. Yep. All right. And can you see my screen? This slide?
Yep.
Awesome. Yeah. Thank you for having me. And thanks for sharing your work, Cynthia. I feel like our presentations are going to echo some of each other, which is awesome. And it's really cool to see all the different work going on in different areas. Where the Voice Project started actually in Oakland and then moved to be across Bay. So we have work going on at UCSF in San Francisco and in Oakland. So it's cool to see the work going down in SoCal. But yeah, thanks for having me. And I'm here to talk about why and how to integrate youth voter engagement into your practice by sharing some of what I've learned through my work on the Voice Project, which was founded in 2018 by me and Dr. Stephanie Fong Gomez. And it's a growing grassroots effort of pediatricians, young leaders, teaming up to help youth and families, especially those marginalized by multiple systems of oppression, to flex their political power. And we've been doing this through outreach, direct outreach in pediatric spaces, capacity building, so using some of those similar tools that we've already been talking about, teaching providers and collaborating with local community orgs. And then we also do some research and advocacy. And part of why we do this, as everyone has talked about, is that voting impacts health. And we won't belabor this point because, as I said, you're all here for that very reason. You know that voting decides public policy that affects healthcare access, housing, education, the health of our climate, and more. And just to mention it, there's also a lot of emerging evidence that reveals how youth civic engagement actually predicts better health and economic outcomes into adulthood. So effectively engaging adolescents and young adults also around civic participation also requires us to recognize unique considerations for that age group. And the developmental changes of adolescents actually present some awesome opportunities. So when we look at the cognitive, psychological, and social domains, there's a bunch of changes that happen in adolescence that actually make voting a developmentally appropriate milestone. So cognitively, youth are starting to think more hypothetically. There's identity development that's going on, increasing empathy, rising autonomy, and heightened sense of morality and idealism. And taken together, these developmental shifts make voting a developmentally appropriate milestone. And it's actually a chance for us to play at our adolescent patients' strengths and take a strengths-based approach to their health. Another thing we know is that youth are really powerful. As much as it's our job to help our patients and families feel happy, healthy, strong, it's really worth noting that the leadership of young people has already been central to historic and contemporary social movements, including some of the ones shown on this slide. In terms of voting, what this slide shows is some of the top issues that determined the vote for youth ages 18 to 29 in the 2020 election. And they included several issues that I know this group cares a lot about, including the health of our climate, racism, and healthcare access and affordability. Youth also do face unique barriers when it comes to voting. And in particular, youth of color have been shown to face additional barriers to voting, including higher rates of difficulty locating their poll places, long lines, restrictive policies including voter ID issues. And on this slide, the long green bars show how restrictive voter policies disproportionately impact people of color. But in addition to the mountain of barriers, there's a number of things that have been shown to facilitate youth civic participation, including engagement in healthcare spaces, which is what we're talking about today. So how can we actually help patients build the healthy habit of voting? At the Voice Project, we were involved in various initiatives from the individual to the community level, but the remainder of today, I'm going to be talking about the interpersonal space. So specifically engaging adolescents and families around voting in clinical encounters. So we'll just start with a case. Your patient arrives, she's an 18-year-old female here for an annual checkup. How do you approach civic participation with her? And so you can start with, I think I mixed our side. Yeah, you have a bunch of options. There's different places in the visit where you can start that conversation. So in PEDS, we often use what's called the HEADS assessment, which looks at the home, education, activities, and a few other things to do a psychosocial assessment, and asking about voting fits really nicely in there as well. It can fit in really nicely with anticipatory guidance that primary care providers are always doing. And it can also fit in really nicely in the visit wrap up. And you can start with a really simple question. Are you planning to vote? If they say yes, you can say, awesome. What questions do you have about voting? And if they say nope, you can say, thanks for sharing that. Why not? Research also shows that there's a continuum of actions that are required to vote and remain civically engaged. Young people learn about their role in democracy well before they turn of age to vote. And once they believe their voice and vote matters, they have to take many steps each election cycle for a prospective voter to actually make their voice heard. And our goal is to meet patients as well as their families wherever they are at, to support them along this journey from left to right on this roadmap, from getting ready, getting set, and then actually going out to vote. And to remind them that wherever they're at in that journey, whether they're pre-registering to vote for the first time or they've been doing it regularly, that their voice matters and you as a provider really care about their voice and their vote. And meeting the patient there can mean different things depending on the time, context, where they are on that roadmap. If you have the time, you can ask follow-up questions like, what issues matter the most to you? What's your voting plan? And if you don't have the time, it still can be really worthwhile to just normalize conversations about being registered to vote as a developmentally appropriate milestone for young people. And there's a lot of tools that are out there, as we've talked about today. So at the Voice Project, for the getting ready portion, we used badge buddies, some in collaboration with Vote ER with the QR codes to online voter registration. We had paper registration forms with envelopes and stamps. We also had a few partnerships with both with community partners and as well as in-person navigators. What's awesome about the badge buddies is that you especially in places like California with fully online registration, you can literally show someone the QR code and they have full ability to register on their phone without having to turn in any additional paperwork. Here's some photos of those things. For getting ready, some other tools we use at the Voice Project included sharing resources for patients and families to take home, like links in the after visit summary. And then for going to vote, you can have conversations with patients about their voting plan. And most importantly, as I said before, just reminding them that you care about their voice and their vote and that it matters. And I'm not going to get into a lot of FAQs today, but one that I wanted to mention was do teens even want to talk about voting at clinic visits? And one thought I have to offer is, given the connections between voting behaviors and health, it's actually an opportunity to normalize this discussion, just like we do with other sensitive and personal topics at well checks regularly, and possibly other visits as your clinical intuition allows. Another thing I wanted to share is, as a part of our research at the Voice Project, we interviewed a number of people, of youth ages 16 to 24. And this quote from a 22-year-old, she said, "If a doctor told me that I can make change by voting, I would be like, yeah, totally. It shows that they really care about us." And so many young people, including this interviewee, are actually really excited about civic engagement being discussed in healthcare spaces and being given the opportunity to register to vote there. And so with that thought, I just wanted to thank you for your interest in growing young voters, and feel free to reach out to me with any further questions. I'll be here for the Q&A, and you can check out our website.
Wow, thank you, Nora. That's fantastic and so inspiring. What an opportunity. And oh, I just thought of a question, but I better save it for the Q&A. So let's see, I need to share my screen again. One moment. Okay. So next we have our own Eve Yalom, who's going to talk to us about her experience being one of the first people in our Voting for Climate and Health team to say, hey, I think I could do this at my workplace. So do you want to take over, Eve, and tell us some of your experiences?
Sure. I don't know if I'm on the screen or not now.
Maybe I'll stop screen share now. There you go. Go ahead.
Hi, so I'm Eve Yalom. I'm a semi-retired OBGYN. I've been working at La Clinica in Oakland for a few months now, and just sort of gotten involved with the Vote ER for the last couple of months. And I thought, I haven't done this before. It's a little daunting, trying to figure out a new system, but what the hell? Why not? So, because I really believe in this stuff. It's great. So, in addition to just showing my badge and talking to patients, and the more you do that, the more comfortable you get doing it. Just figuring out the right place to put it in the conversation. And patients, they really respond well. I mean, I have not had a patient say, I'm not interested in this. So I thought, okay, let's just put some posters up. Let's get some of the Vote ER posters and put them up in the clinic. Well, that seems like a simple thing to do, but it actually gets to be quite complicated. And you wanted to go through, it's really important to go through the channels. So I talked to the head of the medical, the medical head, and then he put me in touch with administration, and then administration wants to make sure that it's not, conflicting with things that they've done. And they've also been doing work with Altamed. So they wanted to make sure that that was all okay. But turns out the administration is totally behind this. And it's just wonderful to be with a group of people that are. So first thing I did was attend a Zoom meeting with people who are on the voting committee. I was the only physician there, and it's amazing how many people are doing amazing stuff, the community outreach and voting. But they were all excited about the Vote ER stuff because it's easy. It's just easy to use. And we, are very much trying to incorporate it into the registration process. So I just felt like I was a catalyst at the right time to do this, and just doing very practical stuff like, what should we name the clinic? What should be our text name? Which posters do we think are good? And that actually brings people together. So I think there's something about just doing the practical work that's good. And I just keep sort of knocking on doors and talking to people, and you just don't know where the champions are going to come. I actually showed the head of the clinic I said, come on, just take a look at this. And turned out she wasn't registered to vote. So when she was able to register to vote, she wanted to share that with all of the front desk people when we had our department meeting. And it was like, this is really easy to do. And that, is exciting. Or I just walking through the exam rooms and saying, hey, you know what? These posters about Zika, we don't really need them anymore. Let's clear them out, and let's find a place where we can put our voting things. But things take time, and I think one of the things I've learned is, and of course everybody who's doing community engagement knows, is the idea that this is good for patients' health seems to really resonate with people. And I don't think that some of the people in the offices have really thought about that. And so bringing that up, I think, is inspirational for the people. So that's where I am. And I'm just so thrilled to be meeting so many incredible people in the organization that are moving this forward. So
thank you so much, Eve. That was really inspiring, showing that, even though you don't think you know what you're doing, just getting started, talking to people, humbly seeing what everyone else is doing and joining that community is good for the patients, it's good for our communities, and it's good for us, right?
Yeah, it's really good for us.
And I want to say, we didn't even talk about this. This wasn't a plant, but that idea of, are you registered, fits perfectly with what we're going to do next in our action hour. So let's move to the next step. So we have 4 simple actions, and the first one is check your own registration. Many of you may not realize, but that doctors are among the worst people in terms of actually being registered and voting. So if you would just get out your phones, put it on camera, and scan this QR code, which the lovely Karina is holding up for us. And if you haven't done the scanning before, just focus your camera on it, and then a web link will pop up that will take you directly to the site to check your own registration. So we're going to give you about a minute or so to do that. And if you can kind of let us know, I guess we should have a signal when you're through with that. Maybe you can put a reaction in the chat. Oh, and I'm sorry, I forgot. I'm going to go back. In the meantime, I am going to ask you too, if you would in the chat, put a plus next to your name. If you have already used Vote ER and have a lanyard, put 2 pluses if you've actually used your lanyard in 2022. A lot of people had them and then hung them up after the 2020 election. So 2 pluses if you've used it recently, and 3 pluses if your institution or your site actually has a team or an institutional process.
Maybe you can put a thumbs up in your window if you've been able to register to vote or checked your registration.
Yeah, thumbs up would be perfect. Oh, I see one. All right. So I think we'll go on to the next action, which is along the same lines. Let's see here. Action 2 is to order your own Vote ER badge. And I'm going to show you how to do that. And Margie's going to post the link in the chat so you can go on your own screen and register. But It's super easy. We're just going to click the get started and then order your Vote ER badge. And you'll see there's a great video here to watch that's real inspiring, but you don't have to do that to order it. Just click here to order your free badge. Fill in this demographic information, your shipping address, and you'll get a free badge. And Chelsea, what's the wait time for those these days?
Should be less than 30 days.
Yes, and you can also order a digital badge that you can print out yourself very soon. Is that correct? Chelsea?
I don't think that we do digital badges for folks to print
Oh,
out, but
not
I
for
can
individuals.
follow up on that. Yeah.
Okay. Oh, that's for the site-based. Okay. All right. So we'll give another minute for people to start that. And of course, you can go back and do it. But if you can order it right now, that would be terrific. And maybe if you put a thumbs up in the chat once you've had a chance to do that, that would be great too. And I have, all right, our next action. Oh, I have to go back. Here we go. Is going to be just exploring the resources. So again, if we go to the Vote ER site, you'll see that we have a lot of resources. Under Get Started, you can get your badge. You can also do bulk badges for your team. And the resources, which are super helpful, if you click on the resources as a whole, you'll see a one-page document to share with your administration, to tell them the information, a slide deck in case you want to show a short informational presentation to your colleagues, information about doing telehealth, when you want an after visit action, this prescription pad is a great way to just pass out information, and that does have the QR code on it. Frequently asked questions. You know, I'm worried about interfering with care. How do I bring it up? All those kind of things. And then there's also wonderful conversation starters if you don't know what kind of language to use to encourage your patients to vote. Okay. And last in our action is please consider Vote ER for your institution. If you'd like to find out more about how to launch your team, please put your name, email, and phone number in the chat, and one of us will get back in touch with you. And consider being a champion at your site. And our contact information is here, and Margie will post that in the chat as well. So now it's time for our panel Q&A, and Margie is going to take over as moderator.
Hello. Hello, I'm on my messages. Now we have a few minutes to role play some of the potential scenarios that you may encounter as you start to launch Vote ER in your institution. And we want to answer any questions that you have. And maybe I can start off with a question, because this seems to be a looming question. Is it legal or just too political for a medical institution to have a vote registration in their institution? And maybe Noor or Cynthia or Chelsea can help us answer that question.
I'm happy to jump in, but also Noor and Cynthia, y'all work in medical institutions and settings. It is 100% legal. The 1993 Voter Registration Act ensures that for nonprofits, health and human services institutions, nonpartisan voter registration is 100% legal.
Yeah, it's exactly what I was going to say. And it's actually the same law that got the DMV to start doing voter registration in like all DMV locations. And that same law like empowers health clinics to do the same thing. And actually the wording of it, if you read it, actually sounds like it encourages it, not only legalizes, in my opinion.
And I'd like to just also take this opportunity to emphasize the difference between a political topic and a partisan one. So we talk about political things all the time with patients, like guns, contraception, just to name two, but we don't take political sides. We talk about the impact the issue has on their health, which is what we're doing with vote.
Oh, we've lost you. Oh, we lost Karina.
Once maybe Karina logs with her audio is fixed, for us also when we talk about nonpartisan work is that it's letting individuals know who or what to vote for, but providing those resources and that accessibility. So that's why we're really careful in that. So we always say it's nonpartisan work. And currently in our clinics, we have voter registration forms. So individuals can pick them up.
Thank you.
Exactly. Thank you.
So I see this got covered in the chat, but I was going to say, do you need to get permission to just even wear a lanyard in your clinic? And Chelsea responded. Maybe Chelsea, you can just elaborate what you said in your chat.
Yeah, this is a great question. And I do think that our number one go-to is that each provider should follow the protocol that they, that is like the policy or that they feel comfortable with at their institution. So on the FAQ page, that is one of the questions that we address. And the answer is like the vast majority of healthcare workers do not need to get approval because it is a simple, again, nonpartisan lanyard that you are not interfering with services in order to wear. Some institutions have very strict protocol around uniforms. My background's in social work, and some crisis social work, it is unsafe to wear lanyards like this one, right? Even if it is a breakaway lanyard, they are not allowed in the institution. And so especially in situations like that, we want to follow the protocol and the policies of the institution while also figuring out how we can make it the least burdensome for providers to offer this intervention among the services that they are providing.
Great. So let me ask if people have had any problems instituting this as a part of registration or part of their after visit summary. Have you been able to incorporate it as part of your workflow?
With the voice project, we were like prior to the 2020 election, and actually at UCSF, they were able to for a while get like a standardized message across like all after visit summaries, similar to what Dr. Yalom was talking about earlier. When you start getting to after visit summary type stuff, and even earlier on, like sometimes getting that institutional buy-in can be difficult, and like going through the appropriate channels, getting approval for those messages. And so we were able to get it done like for a short period of time prior to the 2020 election, but it's not something as of now that was able to be, that we had integrated for like beyond that. But we're gonna like try again and see. It one thing that people also like, instead of getting it standardized, one thing that we were able to do is just create like dot phrases. So like individual providers can also in Epic just like click it and add it to the end of their after visit summaries. That's a little bit like easier to do, similar to the previous question of like what an individual provider is doing versus getting it like standardly integrated. That's just some thoughts on that.
Yeah, what we're trying to do, and we haven't done it yet, is they have the nice picture of the after visit summary and just have that by the registration. And we're going to try to get the people at registration to hand out those sheets when people come in, because that has the QR code and the text messaging so that people can have it as a piece of paper to go with them. That's the goal.
The other thing I saw under resources is now that they VoteR has now a little prescription pad with the QR code, so you could hand it to them when you're handing them their prescription or whatever, and they could take this home. So it doesn't even, you don't even have to talk about the badge, your badge. You can just hand them the prescription and they take it home and they can do it on their own, at their home. So I thought that was a really nice addition to the resources, Chelsea. Yeah.
Yeah, and then for us, we did have messaging on the elections in 2020, along with census 2020 and being counted and the importance of that. But then also with COVID, we had to pivot into, because we are a healthcare organization, to the different messaging. And I'm really glad to hear about those dot phrases in Epic, because that's what we use. But I'm gonna maybe email you on how does that work, and maybe the process on that, because that would be great. I'm sorry, Nora. Yes, I was.
Yeah, please do.
Right. Does anybody else have any questions or any concerns they have about starting this?
I had a question for Noor. Isn't there something about California and pre-registration? Can you tell us about that?
Yeah, and it's awesome. In California, 16 and 17-year-olds can also pre-register to vote. And what that means is that like when you actually, it's the same website. So you can show them this QR code, you can do a paper form. And what it means is that you're automatically in like the government system. And so when you turn 18, you're registered to vote as long as you filled out that paperwork at 16 or 17. And so once you turn 18, you can vote in that election.
Great. One thing we found that talking to some people at UCSF that, you know, a lot of the efforts were done really close to the 2020 elections, and it felt more partisan that way. So if we start this whole process of registering to vote away from the midterms or some big election coming on, it won't feel as partisan to people. It's just something that, you know, you need to do to take care of your health and your health care in the future. So starting now is a really good time to do that instead of so you probably hopefully won't be encountering this partisan issue that it's, I mean, a partisan issue. So, you know, this is why we were really trying to get it going now.
Right. And well, I have a comment about that and another question for Noor. So first the comment, right, what we're hoping to do is really get this initiated. And as Cynthia Romo said, just get it started. Start with the small stuff, get people used to the idea and doing registration, and maybe gradually build it into the institution and even into the workflow would be fabulous, so that it's not a burden on individual providers, but to really try to do that over the next 3 months. And then maybe in July, August, start working on the next step, which is, okay, now we're getting people registered. Now we need to let them know when elections are coming up, where they need to go to vote. California, I think, has all mail-in now, which will make it a lot easier, but still people need to know when an election is coming up, especially the local smaller elections that people tend to neglect, but we're learning are so important. So we're hoping to do more on that, and maybe we'll have another webinar in 3 months, like for the next steps, and then the get out the vote stuff. Again, non-partisan, not saying who to vote for, but connecting the climate health with who we elect and the need to vote. And that kind of brings me to the question for you, Noor. I think people think, oh, pediatrics, it's only going to be, 17 and 18-year-olds like teens, but how do you approach families? And do you find that, do you ever talk to them about this improves the health of your child going forward to have a safer community and vote for climate and health? Have you ever used that message?
Yeah, I mean, I think that's awesome. And I think definitely people use that, and we emphasize that we were like, especially in pediatrics, you're talking to the whole family. Just to clarify, as I'm a medical student, not a pediatrician. So in terms of me doing it myself, I have not done that as much in the clinical visit, but we also had resources in the waiting room where you're definitely engaging with the family all together. And then, yeah, you can bring this up at any visit, talking. And younger, as we mentioned earlier, younger people also, whether or not they're eligible to vote yet, people start learning about voting and getting you can still normalize that conversation early on, so that someone knows that when they turn 16, when they can pre-register to vote, when they do turn 18, they can register to vote, and then family members too, and also young people can encourage their family members, and then family members can encourage their young people. So I definitely agree that you can bring it up then. It may affect, for example, I mentioned the HEDS assessment for teens. That's a great place to bring it up. For if it's a younger patient and you're engaging with family member, maybe you're going to do it at the end of the visit. Maybe we're going to do it alongside the anticipatory guidance instead. But I think definitely that's important to do as well.
Oh, thank you. So Margie, I think we're pretty much at the end of our time. Some of us can stay on if there are more questions, but do you want to wrap it up for us?
Okay, thank you all so much for joining us. I think the speakers were all so inspiring and leading the way and showing us how we can do it. So we're very thankful to Noor and to Cynthia and to Eve for their leadership. And we can see how VOTER is such a powerful tool to give our patients a voice to demand a healthy and safe environment. So if you or anyone you know would be interested in launching VoteER, please contact us, either Cynthia or I, and we will follow up with you. And we'd love to give you support. We'd love to brainstorm with you, and please join us. Thank you. Any questions? Chelsea, do you have anything to add? Chelsea's our VoteER liaison, so she's been a fountain of information and support for us. So if you have any questions, she's also a great resource.
I think I dropped in the chat just the last thing I wanted to add, which is that for posters and handouts, those custom like discharge paperwork, etc., you can also order those along with the badges on VoteER's website. So I dropped the link for that in the chat. And yeah, like Margie mentioned, I'm happy to be the VoteER point person. We don't actually have a staff person dedicated to California, unfortunately. We have less than 10 organizers dedicated to individual states. And I'm actually the North Carolina organizer. But in my other life, I am a climate activist. And so when we saw that y'all were reaching out and we're so passionate about this work, we really wanted to make sure that we were supportive of the partnership, and it felt like a really natural and serendipitous fit. So I'm really happy to be able to support y'all in whatever way that we can. So if y'all ever have questions about the website or materials, anything like that, feel free to get in touch. And also Nora and Cynthia have been amazing resources throughout this panel. So just want to encourage y'all as well to lean on them, because they have a lot of experience introducing these in the field, which I don't have as much experience with. The other question I wanted to point out in the chat, someone asked if you could wear these when you're doing community work, that's like volunteer work. And the answer is yes, but please do not use them when you're doing, like if you volunteer with a local political party, or if you volunteer with a local candidate in your own time, that's awesome. We encourage that, but please don't use these when you do that, because then it starts to affiliate VoteER's materials with those candidates and starts to cause some compliance issues as far as like the nonprofit and nonpartisanship is concerned. So for example, like I actually do volunteer as a clinic escort at Planned Parenthood, but that is a position where I am engaging with clients in a volunteer way, right? And I'm not working on behalf of any political party. It's not Planned Parenthood's advocacy wing, it's their client wing. So I wear it when I do that work, but if I were ever going to go advocate on behalf of a piece of legislation that talked about abortion laws, I would not wear this.
So thank you so much, you guys. Please put your name and your contact information so we can all, get together in the future and we can contact you if you have further interest. So please put your name and your contact information in the chat for us, so we can we know where you are and who you are. Thank you so much. We leave the chat open for a little while for that.
All right. Thanks, everyone. Appreciate your attending, and we'll try to get this recording out and hopefully post it on our website. All right.
Great.
Thank you.
Thanks.
Thanks. Okay, we got the
core back.
Oh, brilliant. All right.
Good job, guys. You guys did such a good job. Eve, you were inspiring me. Oh my God, you were so great.
Okay.
Yeah.
I wish we had more people, but oh well.
The
way it is.
But you know what? We got one person who is really interested, and that's the
Social worker.
Maria Krenin. She's a social worker. So I took all her information down, and she's at KP.
Yeah, and that really is exciting to me because I think social workers have so much potential.
Mhm.
And if she can help connect with other people, that could be a wonderful, wonderful connection. Cynthia, thank you so much. I'm just loving, I'm loving this connection.
Yes. Bye.
Bye.
I also asked Nor to let me know what KP people she knows are already involved, because when I tried, they said, oh, we already have our own voting effort, underway. And so that was sort of the reason they incorporate that somehow into, that's part of their non-for-profit status. They do that community engagement, but I don't think the way we're thinking about it.
Well, I think we generated some interest, so that's great, and we can take this on the road.
Yeah. How do we get to take this on the road or share it with other groups? We should think about that.
Yeah, and I think really part of the problem is that I have had probably 24 invitations for today, tomorrow, and the next day for so many Earth Day related things.